Hello guys, welcome all of you to today's PYQ Shots, and let's begin with today's question, guys. A patient of cisplatin-induced nausea and vomiting was injected an antiemetic, after which he developed dystonia and Parkinson's disease-like features. Which of the following drug was injected to the patient? Look at the options. Option A, scopolamine. B, metoclopramide. C, ondansetron. D, meclizine. So guys, pause the video. Let me know the answer in the comment box. Right now, coming to the question, guys. Antiemetic was injected. He developed dystonia and Parkinson's disease-like feature. Now, this is extrapyramidal side effect, isn't it? And which antiemetic can cause extrapyramidal side effect? It has been asked a lot of times, guys. Your answer is always option B, metoclopramide, because metoclopramide can cross the blood-brain barrier. Plus, it also blocks D2 receptor. So, just like antipsychotics, it can also cause extrapyramidal side effects. What are the other PYQs that have been asked with respect to metoclopramide? Let us see. Which of the following is an antiemetic or prokinetic? Two MCQs, which act by blocking D2 receptors. Your answer is metoclopramide, a fairly simple one. Second, this MCQ, which they have asked, it was asked in a different way. A medical student was admitted to the hospital with severe nausea vomiting. He was given an antiemetic and he developed abnormal posturing, right? And which drug he was given? Again, your answer was metoclopramide. That abnormal posturing is what is acute dystonia. PYQ number 3 here, they have asked you, is a patient, the same kind of thing. A patient with nausea vomiting was admitted. It developed abnormal posturing. What is used for treatment, right? That MCQ is about treatment. Your answer is promethazine. So once they had asked what is used for treatment, your answer is promethazine. PYQ number 3. PYQ number 4, they had again asked you what is used for treatment. Now this time promethazine was not in the option. What they had given in the option was benzhexol. So then your answer was benzhexol. Now the team, PYQ number 5, there asked the same question, what is used for treatment? There was neither promethazine nor benzhexol in the options. There was trihexyphenidyl. So remember, whenever a patient develops acute dystonia or Parkinsonism due to either antipsychotics or metoclopramide, my drug of choice is benzhexol, which is also known as trihexyphenidyl. If it is not, I don't have that drug, then I can also use an antihistamine called as promethazine. So these are the PYQs which are asked with respect to metoclopramide. Let's look at other options. Scopolamine. So what is the MCQ that is asked? Scopolamine. Day in and day out, they ask you, what is the drug of choice for motion sickness? Your answer is scopolamine. Second, what is the route of administration? PYQ number 2. For scopolamine, it is transdermal, not oral, transdermal. PYQ number 3. When do I apply a patch? Say I apply the patch night before they travel. Right? So I need at least 4 to 5 hours. That's PYQ number 3 with respect to scopolamine. PYQ number 4, and that is which drug is called as truth serum? Your answer is scopolamine. PYQ number 6, which drug or anticholinergic is used in narcoanalysis? It is scopolamine. That is the reason why it is called as truth serum. Look at option C, ondansetron. What are the MCQs that have been asked? A simple one. Which of the following is a 5-HT3 antagonist? Ondansetron, you got to solve such type of MCQs. PYK number 2, which of the following is a drug of choice for chemotherapy-induced nausea vomiting? Single drug of choice if they ask. Ondansetron, because ondansetron is the anchor drug. Anchor drug means it is the drug that will anchor to the disease. Other drugs can be added onto this, like aprepitant, etc. PYQ number 3, for ondansetron induced nausea vomiting. I mean to say ondansetron cannot be used for treatment of nausea vomiting caused by which drug? And the answer is apomorphine. So apomorphine induced nausea vomiting, I never use ondansetron because ondansetron severely increases the risk of hypotension. Meclizine, as it is not that much asked nowadays, meclizine is a first generation antihistaminic. It can also be used in nausea vomiting, that is motion sickness. But MCQs are not really asked. They prefer to ask about scopolamine. So guys, that's all for today's PYQ shots. Tomorrow I'll be back with another PYQ.